Like, share, and subscribe.
Hello, good evening. Myself, Dr. Naveen from Magna Centres of Diabetes at Manikonda. Today, I'm going to share the topics about what the complication of diabetes has to be screened and how often. Generally, the patients with a prolonged duration of a diabetes with uncontrolled hyperglycemia lead to a multiple primary vascular that affecting both small vessels, nothing but microvascular complication, and affecting the large vessels, nothing but macrovascular complications. Generally, in the diabetes, we'll see the main complication is microvascular complication. So generally, they are subdivided into diabetic retinopathy, nephropathy, and neuropathy. So among these three, diabetic neuropathy is the first complication to get damage in the diabetes patients with uncontrolled hyperglycemia. So diabetic neuropathy that has to be screened for all the type 2 diabetes at the time of a diagnosis, and for type 1 diabetes soon after the 5 years of a diagnosis. So the main thing we have to see in the diabetic neuropathy is a foot examination. Generally, we have to inspect our foot daily, and we have to see any intertigo, any infection, Vesper's infection, or any ulcer in the foot, any corns, callus. Okay, we have to inspect thoroughly, and this can be done the foot examination by two methods. One thing is 10-gram monofilament or a biothermometry (VPT), what we call as a vibration perception threshold. Some do's and don'ts are there in the foot. Just I want to tell you that do's, what we have to do in the foot. See, first watch the feet daily, and second is inspect the feet in a mirror. Then keep the foot dry, especially in the web spaces. Then wear the shoes that are broadly widened, and sandals with a velcro, mainly a canvas shoes we can say. Then don'ts, what we have to should not do don'ts in the sense, should not keep the foot in a warm water or hot water, and should not soak in a hot or warm water. And do not try any home remedies if a corns or callus is there with a corn cap. So this is a diabetic neuropathy. The next comes is retinopathy. This is the most common microvascular complication that occurring in both type 1 and type 2 diabetes with uncontrolled poor hyperglycemia. But in all the patients with a diabetes should have a complete eye examinations. Routine glasses test may be mistaken by the retinal examination by the most of the patients. So screening should be done by a fundus examination followed by a pupillary dilatation of both eyes. In type 1 diabetes, initially the screening has to be done after the 5 years of duration of diabetes. Then thereafter annually we have to do. In case of type 2 diabetes, at the time of a diagnosis we have to screen, and thereafter annually. But in case of pregnancy, there's a pre-existing diabetes. So initially we have to be screened prior to the conception or during early first trimester. And thereafter, every 3 to 6 months, even in the case of mild to moderate NPDR, and every 1 to 3 months in case of severe NPDR is there. The next coming to the other complication is diabetic nephropathy. It's defined as a presence of persistent protein albuminuria of more than 500 mg per day in a diabetic patients with a concomitant evidence of retinopathy and hypertension in the absence of other kidney or any renal tract disease. So for early detection of diabetic nephropathy, it is recommended that in the type 1 diabetes over the 5 years of diagnosis, over the 12 years of age, okay, should be screened, should have a urine screen for moderately increase in albumin excretion that we call microalbuminuria. Thereafter annually. But in case type 2 diabetes have to be done at the time of a diagnosis and thereafter annually.